How's things been since our last visit?
It's looking a little bit more angry, a little bit larger. So
yeah, I can see from here it already looks a little bit bigger, and we've got a little bit of bleeding there too. Has that been happening at home?
Yeah, there's a bit of blood happening that night, especially.
Yeah, definitely it's grown quite a lot since last time. I can feel it swelling down here below the jaw, so it's definitely is growing and starting to spread.
3 days ago, Matt took a sample of the worrying growth and sent it off for urgent analysis.
The results have come back. The pathologists think it's a squamous cell carcinoma. This is a kind of cancer that we sometimes do get in the mouth. No cancer is a good cancer, but this is one that we do need to intervene in. It can start invading tissues around the mouth.
Daisy is going to need major surgery.
We maybe have to try and remove that part of the jaw that contains the tumour. Good girl. The rate this cancer seems to be growing, if Daisy didn't have surgery very soon, the cancer's going to invade a large portion of her mouth, and as it grows, it will grow exponentially, and before you know it, it's going to be painful for her, and eventually it's going to affect her ability to consume food and survive, and she's going to start wasting away.
You're going to be all right, sweetheart.
Poor little girl. We're going to help you out today, girl. It does look like it has gotten quite a lot bigger. It's a lot more vascular, so we're getting some bleeding there, which is concerning because a cancer with a good blood supply is fast-growing cancer.
Daisy needs urgent surgery, which will involve removal of a large section of her jaw, and recovery will be challenging as she adjusts to a dramatically altered mouth.
It seems like it's grown quite quickly, and it seems like she's quite sensitive and painful around it already. So I think that, we may have to take out quite a bit of that jaw to make sure that we get it all. We're going to have to be, reasonably aggressive. Most of these lumps will require removal as soon as possible to stop them spreading.
It's not the news owner Tara was hoping for.
A bit shocked, a bit overwhelmed to be honest, but I know that she's in really safe hands with Dr. Matt, and we've been really happy with the care we've received here, so I'm just got to be hopeful for her.
Well done.
Fortunately for Daisy, this isn't one that's end of the road, but this is one that we do need to intervene in. I just think if we're not aggressive now, we might lose our opportunity to get on control of this while it's
Definitely
still...
want to nip it in the bud.
Yeah, exactly. Yeah. If we delay it too long, we're going to end up having to take the entire half of that jaw off, which is obviously much more traumatic for Daisy and less chance of getting all of the cancers.
We'll see you really soon, okay? We're going to take good care of you, okay? I love you, my darling. Bye, darling. You'll be fine.
Come on, Daisy. Come with me, sweetheart. Come on. Good girl. We're going to give her plenty of pain relief and plenty of cuddles and just make sure that she's best taken care of as we can. Ready to go now, nice Daisy? You look very relaxed.
I know, she does, doesn't she?
With Daisy fully anaesthetised, Matt can get a better look at the extent of the nasty tumour.
It's actually looking a lot bigger than I initially thought it would. It seems to be stretching right down into that bone. So this is a very timely procedure to be getting in here. It was a little bit of a surprise. The comment from the pathologist said that the cells didn't look extremely aggressive, but certainly the gross appearance of this cancer just seems to suggest otherwise, and that it is growing quite quickly. So we're going to probably look at cutting probably here and back here. So it may even be more like sort of 3 inches or more. It's a very nasty looking thing. Go and we'll take a couple of quick x-rays of that jaw. We're going to have to take reasonably big margins on this, which means a lot of tissue, a lot of bone, some teeth to ensure that we get all that cancer out. X-ray. This is about where the cancer is. So we're going to try and remove back to here and up to here. We're going to try and remove this portion of the jaw to make us feel a little bit better. It's never fun to do these aggressive cancer surgeries on dogs, but the downside is if we don't do it, she's really going to suffer and her life's going to be very much shortened.
In Melbourne, Matt is about to perform radical surgery to remove a rapidly growing cancer from rescue dog Daisy's jaw.
It is going to be very challenging because if I don't get those margins, then we're almost back at square one and the chances are worse that the cancer may have spread.
The shy 9-year-old Greyhound has won Matt's heart.
She's a lovely dog and she's come up through the Greyhound adoption program and found a nice family, and it'd be horrible if she didn't get to live out her full life now that she's on Easy Street.
It's going to be an anxious wait for devoted owner Tara.
I feel a bit nervous leaving Daisy here today because it is such a major procedure that she's going through, but I also feel confident that she's under really good care.
So what I need, Michelle, if you can try and hold this lip as far away from the jaw as possible so I can make an accurate incision.
As Matt begins the delicate surgery, he's feeling the pressure.
We've got a big blood supply, which means big blood vessels, arteries and veins that we're going to have to deal with. There's also, as you can imagine, a lot of nerves in the mouth that tell the brain how we're eating, what we're tasting, all these sorts of things. And we're going to be obviously cutting through those.
Pretty brutal, isn't it?
Yes, pretty brutal. We're going to have to get rid of all the soft tissue, and then once we've done that, then we can drill through the bone and remove the whole chunk of cancer and the surrounding tissues, hopefully with good margins. Can you pass me that drill? So that's the artery that's going to be the problem. All right, so this is what we've been after, that. So we've got about 1 centimetre or so behind it, and we've got more like a couple of centimetres in front of it. So hopefully that's enough. Nasty looking thing. I'm a little bit surprised looking at the jaw, just how deep into the bone the cancer's gone. I may just take a little bit more bone, just because the caudal edge of that sample just looked like it was a little bit close to the tumour, and I just want to make sure I can sleep tonight, that I know that I've got enough. Even if we leave a few cancer cells, they're going to multiply, and sooner or later we're back in the same position with another big cancer there, which I don't think Daisy wants, and we certainly don't want either. So that's that part done. I'm a bit more confident now that I took that extra little piece. That'll just help me to sleep a little bit easier at night. You doubt until you get the pathology report back, and then sometimes you still doubt a little bit more. So the jaw finishes here now. That's the end of the jaw. And back here, the jaw starts again. So we've lost that portion.
As a precaution, in case the cancer has spread via the lymphatic system, Matt's also removing the lymph node at the back of the jaw.
Michelle, have you got that pot? So this lymph node is very small. It doesn't look like a lymph node that's being taken over by cancer cells. And I really got my fingers crossed that the lab doesn't find anything in there. So you've done pretty well there, Daisy.
Before Daisy is moved to recovery, Matt's taking another X-ray.
X-ray.
All good?
Yeah, I think that's good. Okay, so this is the after X-ray. This shows us the area of bone we've taken. So we've removed the cancer and then a couple of centimetres in front and behind. That's it, wake up time, rise and shine. Look, I'm pretty happy with the surgery on the whole. We closed everything up, it looks reasonably tidy. I do know that within a few days, Daisy's going to be in a lot less pain than she was today, so I feel good about that, but I'm still going to be nervous waiting for that email to come through from the pathology. That's a good girl, stay nice and warm. Got that horrible cancer out, here's hoping you feel very much better soon.
In Melbourne, rescue Greyhound Daisy is now fully awake after Matt performed major jaw surgery to remove a nasty cancerous lump.
You all set to go, sweetheart? You go see your mummy?
Devoted owner Tara has spent an anxious day, worried about her special girl.
I can't lie, my day has been a little nerve-wracking, just waiting for the call from Dr. Matt.
Here she is.
Daisy, hi. Hello, gorgeous. How are you feeling?
Been so brave.
So good. She's such a trooper. Look, it looks a bit confronting, but I know that after the stitches come out and everything, she's going to be having such a better quality of life. So I feel really grateful.
So she's gone really well. Obviously she's missing a part of her jaw just here.
Yeah.
So it may get a little bit swollen. No, don't panic too much.
As Daisy recovers, she'll also have to get used to chewing differently.
Look, the dogs are very, very good at moving food around their mouths and chewing on one side if one side's painful or has some dental disease. There'll be a short period of adjustment, but I think that she'll cope really well. Soft food, as soft as possible, so she doesn't have to do any chewing.
I think Daisy is very keen to get home and get on the couch, get snuggled up and have a bit of chicken.
So we'll be getting the lymph nodes back in a few days. I'm fairly confident. It looked very small and unreactive, so I'm hoping that that's going to come back pretty clear. The bone will take a little bit longer. They have to decalcify it, so we're probably looking at a week or more until we can get results back from that one. I think we're all going to sleep a little bit easier knowing that that cancer's not in there growing anymore.
Thank you so much.
No, that's no problem. Hopefully she's jumping forward in leaps and bounds and there's no holding her back now.
Let's get going. Good job, honey. Let's go. Good girl.